Hello, everyone. Welcome to episode 6 of our series, A Doctor's Journey. We have a special guest today, Dr. Jovita. Thank you so much for taking time out of your busy schedule to be with us here today. So, how are you doing today?
I am doing good. Unfortunately, I'm starting a little later because I was in surgery earlier today, but that's
Yes,
the
totally
life of a
understand.
doctor. Yeah. But thanks for having me.
Would you like to tell our viewers a little bit about yourself, just some background information, such as your specialty and where you're located?
Absolutely. My name is Jovita Ruweri. Like you said, I am a breast cancer surgeon. I'm located in St. Louis, Missouri. I've been in practice for about 20 years or so. I know I don't look that old, but I've been in practice for about 20 years. Um, yeah, that's really basically it. So I take care of women, all sorts of women, and sometimes men who have any sort of breast problems or breast issues.
Okay, really interesting. So, to start off, have you always wanted to be in the medical field, or was there a particular moment when you decided that this is what you wanted to do?
I've always verbalized to my family that I wanted to be a doctor since the age of 3. So that's a really long time. I don't remember that, but that's what I've been told. And that's really what I've pretty much talked about my whole life. I knew I was going to be in medicine. I did not know at the time what part of medicine I was going to be in. I just knew I was going to be a doctor. And, then I remember, as far as my memories go, through high school, that's what I wanted to do. So high school prepared me for college, which is where I majored in pre-med and subsequently ended up going to medical school to become a doctor. So all my life will be my answer.
I know that everyone has different experiences and reasons why they want to go to the medical field. So thank you for sharing yours. So,
Mm-hmm.
like you said before, you're a breast surgeon. So, how does it feel to be a surgeon? Like, what are some difficulties that you have faced, and how did you overcome those difficulties?
Well, surgery is definitely one of the toughest specialties to do in the medical field. Um, not just because of the actual work that's involved, because I believe anybody can do that. Anybody can do anything when exposed long enough. So if anyone out there thinks they want to be a surgeon and thinking, oh my God, surgery, that sounds so hard, let that not be your reason for not doing it, because anybody can be a surgeon. For me, the hardest thing about surgery was going through the training or the residency. Just kind of background for the younger people in high school that may not know the whole process. So once you're done with high school, you go to college. In college, most people that want to do medicine will major in some kind of sciences, but you don't have to. Um, I majored in zoology and in chemistry. That was my choice. But I have friends that are physicians that majored in English or that majored in the arts. What's important to do while you're in college is make sure that you take the core prerequisites to take your MCAT examinations, which is generally done around the third, fourth year of college. And the MCAT is basically an examination that you take to get into medical school. Kind of like you take the SATs and the ACTs for college. This is what gets you into medical school. There's kind of a benchmark cutoff point that you have to get for some of the schools to accept you. And, some people want to go to big name schools like Harvard, and some people want to go to their local medical school. To me, it doesn't really matter because you're going to get the same education anywhere. So don't think that the medical school that you go to is going to prevent you from doing whatever you want to, because at the end of the day, everybody graduates from medical school with an MD degree or a DO degree. So don't let that prohibit you. But anyway, so once you're done with the MCATs and you get into medical school of your choice, the medical school is 4 years of learning pretty much everything about the human body anatomy, the human body physiology, the pathology of it, the pharmacology of it, just all the building blocks that teach you how to become a doctor. And through this, each year you kind of build on what you learned the previous year. So by the end of the third and fourth years, where they actually get you to start taking care of patients, not by yourself, but with, physicians. So you're in the hospitals, you're seeing patients, you put into use what you've learned in the first couple of years of medical school. And that's when you kind of start to make a decision. What part of medicine do I want to go into? Some people go into medical school knowing what they wanted to do. I went into medical school thinking I wanted to be a gynecologist. But in the third year, once I did those rotations, I realized that that was not for me, because once I rotated through my general surgery rotation, I pretty much fell in love. I fell in love with being in the operating room. I fell in love with doing surgery. So I ended up deciding that that's what I wanted to do with my life. And there are so many different specialties in medicine. It could be surgery, it could be gynecology, it could be pediatrics, psychiatry, anesthesia, pathology, radiology. There is just so much. So what I would advise, once you get into medical school in that third and fourth year, try to get exposed to as much as possible, because it's that exposure that's going to help you figure out what you want to do for a living, for life. So at that point, once you figure that out, then you start to apply for called residencies. And residency is pretty much a training to hone your skills in that particular field. So for me, it was general surgery. And for me, that training was the hardest. All training is hard because you're really learning to do things that you're not used to. Again, you're building on things you've learned in medical school, but now you have actual human beings that you're taking care of. And of course, a lot of it comes with fear, because you're afraid you're going to kill someone, because that's the absolute worst thing you can do. But remember, there's always someone watching over you, so you're not 100% on your own. They make you feel like you're on your own, but you're not 100% on your own. So there's always someone, and never be afraid to say, I don't know, or I can't do it, and ask questions. But surgery residency, there's a lot of hazing in general surgery residency. That's why it's one of the toughest residencies. It seems that a lot of residency programs, and a lot of it is changing now, they specialize in trying to break you. And if you go into training knowing that that is their intent, you're going to be fine. You're going to make it through, because nothing that they do to you should break you. General surgery is the longest of all the training programs. It's 5 years, and most people spend an extra year or two doing research, which is what I did. So for me, I was in hell for 7 years, but once you're done with residency or training, then that's when you're actually out there in practice as a physician, doing what it is that you spent all these years trying to do. So for me, that's really when life began, when I was done with residency, because all of that was over, all of the hazing and whatnot, and you actually start to practice, and you're on your own practicing and taking care of patients, and that is the absolute best part. But what made residency hard was not just the hazing, but just the hours are really hard. In surgery, we started early. A lot of times we started at 5 a.m. and we did not go home till 8 p.m. at night. A lot of the residency programs have changed today, where they have more regulated hours, where people are not being overworked, but there's still some of them where you're being overworked. So you were just constantly exhausted, just never having enough sleep. But then through it all, you still have exams that you have to take every year to stay in residency, because being a doctor is all about taking exams. You're going to get really, really good at taking exams, because it's nonstop exams. But yeah, so hazing, the long hours, the lack of sleep, just the volume, or the sheer volume of what you need to know, is what makes it hard. But by the time you're done, you're what we call a chief resident. So you're kind of at the end of it where you're starting to teach junior residents. Things start to get better for real. But I'm an attendant now, which means that I'm all done. So I've been an attendant for 20 years and things are just so much better because I've been doing the same thing for a long time. And um, the residency days are way behind me, but it's ahead for you guys. But just be aware that that's going to be the toughest, I think, for you and for a lot of other friends of mine that are physicians. When we talk about it, for them, that's been the hardest, whether they went into pediatrics or psychiatry or surgery. It is the hardest of everything that we have to do. But we all get through it. I did. If I did, anybody can.
Yes, thank you. Great, really great insight. So,
long answer,
no,
I
it's
know.
totally, it's totally fine.
Yeah.
So for the viewers who are interested in going to the medical field and specifically surgery, you kind of answered this question already, but what was the process that you followed to get where you are now? And are there any other pieces of advice you would like to tell?
Yeah. So the major advice is really the third and fourth year to make sure that you get exposed to as much as possible, because that's really the only time that you have to to I guess to learn about each specialty, and that's not a lot of time. And I tell you this only because some people know, like I did. As soon as I scrubbed into surgery, I said, this is absolutely what I'm going to do with my life. But some people kind of think, but they don't know. So I have a very personal story about this, which is my daughter. My daughter just graduated from medical school in May, and she matched into obstetrics and gynecology. That's what she wanted to do. Although her dad and I kind of knew, because her dad is also a physician, that she didn't really fit the mold for obstetrics and gynecology, but you can't really tell people what to do. So a month into residency, she called us and she is in tears, said, I absolutely hate this. I cannot do this for the rest of my life. And we're like, well, what did you do for 2 years? You spent 2 years rotating, trying to figure out what you want to do. And that's what you decided to do. And all of a sudden, you don't want to do it. It didn't make sense to us, but she is now in the process of switching residencies. And in order to do that, you have to complete the year, because you just can't leave in the middle of a training program. You can, but there can be ramifications. So she has to finish off the year. She's reapplying. Now she wants to do anesthesia, and she'll start that July 1st. So it's not really a waste of a year because she's learning through this year, but it's just kind of a caution to you guys out there to just be exposed to as much as possible and make sure that when you decide that this is what I want to do, that it's really what you want to do.
Definitely good advice. I'm pretty sure all the viewers will find this information really useful in the future. So as a surgeon, I'm pretty sure you're incredibly busy. So how do you manage to keep a work and life balance?
The work-life balance is super, super important to me. As if you follow me on Instagram, you'd know I'm all about work-life balance. I'm married, I have 2 kids, and I chose to go into surgery, which is one of the busiest of the specialties. But I also knew I wanted a life. I wanted a family. I wanted to be married. I wanted to have kids, and I also want a social life. I'm very, very social and I like to travel. So breast surgery, which is a subspecialty of general surgery, is a field that allows me to do that. I did not want to do trauma surgery because I knew I didn't want to live in the hospital. So you have to choose according to what fits your lifestyle or what you foresee your lifestyle being. I knew that there were really no true emergencies in breast surgery, and I like to sleep at night. So I did not want to be called in the middle of the night to come take care of an acute appendicitis or to take care of a trauma patient or a patient in the unit. So the specialty that I chose really fit my lifestyle amazingly well. I make it a point to leave work at work. And when I'm home, I'm home. When I'm home, it's all about the family and the kids or my friends or whatever social activity I'm doing. Um, and it's something you kind of have to start to try to cultivate from med school and not wait till you're in attending to do that. There's going to be very little time in med school, but make sure you find time to reach out to your friends that are not in medical school, or keep in touch with your family, or do things with them, because you need that lifeline. These are the people that are going to support you through really difficult times. And if you maintain that lifeline, they will keep you connected to the outside world. So that's basically my advice. Keep yourself connected to the outside world. Don't let it be all about being in medicine. Go out to the movies with your friends. Go to the mall to go shopping. Go to theater show. Whatever it is that you like to do normally, make sure you do it. If you play an instrument and you're in a band, continue to do that. Those things are important. Um, for me personally, I'm a runner, so I continue to run. I am a fitness fanatic, so I make sure that I keep up with all that. Like I said, I'm very social. Um, Unfortunately, the pandemic is killing me right now because I love throwing parties. I like going to parties. I like hanging out with my friends, and haven't been able to do a lot of that. Love to travel. Haven't really been able to do that, but if it were not for the pandemic, those are the things that I kind of do to try to keep connected and to maintain my work-life balance and my sanity.
So becoming a surgeon, you have to go through the pathway of university, medical school, residency, and fellowship. Do you have any memorable experiences during your university, medical school, or internship, fellowship years that you'd like to share?
Wow. College, I'm going to say not too much memorable because I was very hyper-focused in college. It was all about getting into medical school. I don't want to say I was a nerd or bookworm, but okay, yes, I was. So there was really not much. So I did not take my own advice. I was all about studying and getting into med school. Once I got into med school, though, I relaxed a bit. I had a very active social life in medical school. Medical school is tough, but that's when I really learned that it was important to continue your outside activities. So you have to make time to study, you have to make time to have fun, and you have to balance the two. So, most memorable um, experiences of medical school is my medical school had a men's rugby team, and myself and one of my classmates I think there was the end of first year, were like, well, why do the men get to have a rugby team? Why can't we play as women? So we started a rugby team, a women's rugby team in my medical school. So that was super fun. So that was what we did to blow off steam. We played women's rugby. It's funny now thinking about it, but that's really one of my most memorable experiences of medical school. And just the times that we had in the gross anatomy lab, dissecting cadavers and just, learning and having fun and building those lifelong connections, because I'm still friends with a lot of my medical school mates. Residency, oh my gosh, residency was tough. But I remember residency, I remember our tight-knit group of residents in my year. We were all really close my year, and we kind of had each other's backs. So if I had something I really, really had to do with my family, it was easy enough to switch call with one of my colleagues so that I could go do it. So we kind of allowed each other to have a life outside of residency. And that was really nice for me. I also had my two babies while I was in residency, so that's really memorable. It's really hard, but very memorable. Um, and then um, as an attendant, I think one of my most memorable, one of my most memorable events was at the very beginning, I would say within the first 2 months or so of being an attendant, being in the operating room by myself without anyone above me checking on me, making sure I was okay, where I was a surgeon, I was in charge, and having something happen where the patient was bleeding, and I was able to calmly get control of the bleeding without having to call for help because I was just so confident in the training that I had in residency and was just very comfortable in my own skin, handling things on my own. So those would be my memories.
Yes, thank
Yeah.
you for sharing those. They're really interesting too. Are there any particular goals or ambitions you're currently working towards?
Yes, I'm always working towards something, so I hate being bored. So I'm always doing something. Right now, I created or founded a fitness group of women. That's really a motivation group of women where I coach them through fitness exercises and challenges and whatnot. And we do this monthly where people sign up and there's prices at the end of the month. So that's just been something I've been working on for the past year. And it's just been great. And I think it's getting more and more popular. So I have more and more people joining every month. And I'm also writing several books. So those hopefully within the next few months, I would have at least one or two of them ready to be published. And just so many things coming up in the future, which I can't even talk about right now. But yes,
Okay,
I'm
so,
looking
oh,
forward to the future.
yes, definitely. So,
Mhm.
bringing up COVID, how has COVID affected you personally and professionally?
Okay. So personally, I guess personally and professionally kind of intertwined. So I'll talk about both together. So personally, I was an employed breast surgeon with a hospital. And because of the loss of revenue from COVID in the beginning, um, I was one of about 60, 70 physicians that they cut from the hospital because they couldn't afford to pay us. So I was not really upset about it. And it just gave me a little pause to think about, well, what do I do now? What's the next act? But I didn't have long to think about that because within a couple of days of hearing from the other hospital, another hospital called and said, we want you. So I kind of moved from one job to the other. So through the pandemic, I've started a new practice, and that's been interesting, where you're working with a whole new set of people that you've never really seen their faces other than behind a mask or through Zoom. Um, breast conferences, which we typically have every other week, conferences where we meet in a conference room with radiologists and pathologists and everyone and social workers and whatnot, and we all discuss patients. I've not been able to do that in this new hospital. It's all been over Zoom. So again, haven't been able to really meet my colleagues the way you usually meet colleagues in conference rooms on the cafeteria. So that's been interesting and very challenging for my patients. A lot had to change the way we did things. Patients came in and typically we have full exam rooms, but we can't have that anymore because we have to social distance. So we can only have maybe one or two patients in the waiting room at the same time. And then when they do come in to be seen, I used to have patients that would come in with family members because, especially for what I do, it's a lot of support that's needed. We can't have many people in the room with the patient at the same time, again, because of social distancing. And then a lot of elective surgeries in the beginning we could not do. But luckily, we're still allowed to do the cancer surgery. So the cancer surgery has not changed, but things that were not cancer or elective, we had to hold off on or kind of prioritize who had to have surgery first. So those are kind of some of the ways things have changed. And, even with getting mammography and screening, a lot of screening was not done for about 2-3 months during the beginning of the pandemic, about April, May. And a lot of that is picking up now. But what that means is that there are a lot of women that did not have their screening mammograms mid last year that are now coming back, and we're finding cancers that were left undiagnosed the year before. So, things are picking up now because we're seeing a lot of cancers that we should have picked up last year but couldn't because we're not doing imaging. So those are some of the ways things have changed for us.
So as Med and Ed, we work with those in underprivileged communities to provide education towards basic sanitation, healthcare practices, and generally just to raise awareness of global health. With that being said, are there any changes that should be made to the healthcare structure to increase equality and provide accessibility?
I think the pandemic has really taught us a lot about that. And it's something, it's a discussion that we are having continuously at our institution, because my current hospital is in not really the inner city, but it's more underrepresented area. And we are trying to figure out ways to deliver care to people who cannot make it. So just really bringing care to people where they are, whether it be bringing in mammography vans to churches or to neighborhoods, or being able to do a lot of telemedicine where we are seeing patients through Zoom or through FaceTime, just to be able to deliver care to people who cannot physically make it in. So those are things that are being done in a lot of places and being explored further in a lot of places. But yes, a lot is changing in healthcare as far as the way we deliver care to the underrepresented.
Yes, thank you for sharing your insight about this important topic. So to wrap it up, is there any last pieces of advice you would like to tell the viewers? Just anything.
Anything. Okay, so I am a minority, and I'm sure a lot of your viewers are too. Double minority. I'm African American, and I am a woman, and I am of Nigerian descent, so triple minority. So what I want to advise you all is that you are probably going to encounter a lot of people that say to you that you cannot do this or try to steer you to a different avenue. If this is something that you really, really want to do, and only you can answer that question, if this is something that you really want to do, no one should be able to deter you or stop you from your goal. But you have to work hard, you have to study hard, you do have to pass those exams. None of it is impossible. It's all doable. So, like I said earlier, if I can do it, anybody can. So we are all capable. So just know that you can do it. If this is what you want to do, absolutely go for it.
Really great advice. So that was the last question, and that wraps it up. So thank you so much for answering these questions with us today and giving us really great information that I'm pretty sure all the viewers will appreciate. Thank you again for taking time out of your day to join us, and to all the viewers, stay safe.
Thank you so much for having me. Stay safe, everyone.